Hi everybody, can you hear and see me? Give me a hello, give me a hello. Just gonna give it a couple of minutes. Okay, apologies for me getting on here for currently 4 minutes late. I was just finishing off on a session and then I've just quickly hopped on here. Hope you're all well this evening. How is everybody? Alive. What about me? Oh, my eye is absolutely killing me. Okay, so you're just gonna have to bear with me, guys. I'm gonna try and be my normal jolly self, but I'm finding it very difficult with the amount of pain that I'm in my eye. So we've got a lot to cover in an hour. And then what I'll probably do, guys, depending on how bad my pain is, if I need to go off to the hospital at 9 o'clock, I will ask you to DM me on Telegram with any questions that you may have. Okay, I'm really hoping I don't have to go to hospital. I don't want to go to hospital again. I don't really want my eye to be prodded out with more needles in my eyes. I don't fancy that, but we'll see how we go. No, you've got a webinar, guys. I'll be teaching you your stuff. Okay. Okay, so guys, I promised you that essentially last week we crammed so much in neurology. I said we'll finish off travel sickness today. So the first things first that we're going to do travel sickness, and then we're going to cover infestations. Okay, so I hope that's all okay with you guys. Okay, and hopefully, okay, I will try to be my normal jolly self. Okay, so travel sickness. Okay, so in terms of travel sickness, guys, it's going to be puking your guts up. Not necessarily always puking, but you're going to feel very sick when you are going to be traveling, whether you're in a boat, whether you're in a car, you know. And essentially the reason why travel sickness occurs is because it's a mismatch between what your eyes actually see and what your inner ear senses. Okay, and as a result, the vomiting center in your brain receives conflicting messages and it doesn't know what to do, so it just makes you feel sick. Okay, generally your symptoms can tend to resolve over a prolonged period of time. So let's say, for example, if you're on a boat for a very, very long time, okay, you'll be seasick to start off with, but then you kind of like you'll get used to it and your seasickness will start to disappear. Okay, it's kind of like a bit of an adaptation, kind of like that your kind of like body gets used to. Okay, it can affect anybody and everybody. It can affect children, it can affect adults. Okay, and it can be caused by a variety of things. It doesn't necessarily have to be if you was in the car or kind of like if you was on the boat, for example. If particularly if you're in a spinny ride in, like, you know, Fort Park, for example, if you're on like a ride in the amusement park, okay, that kind of like can also cause kind of like the same kind of like mismatch, okay, between what your eyes see and what your inner ear sense, and that's what causes kind of like your nausea. So in terms of your symptoms, okay, often kind of like the symptoms will go away once your journey has finished, but sometimes kind of like your symptoms can take a little bit longer to go away in some patients. Okay, so it may take kind of like a few hours or days kind of like to resolve completely. Some very common not side effects, Jesus. Some common symptoms is, of course, you're going to be feeling nausea. Sometimes you're going to be vomiting. You may be kind of like a bit pale, have a bit of cold skin. Okay, you're going to be having you're going to be like salivating a little bit. You know, kind of like when you feel a bit sick and you feel quite nauseous, you tend to salivate prior to you puking your guts up. That's kind of like a similar thing that's going to happen in travel sickness. You may feel kind of like a little bit drowsy. Okay. Okay, kind of like, and kind of like your shallow breathing can occur. Very unlikely, but it can occur. Okay, is that okay for everybody so far? Just give me a one, give me a one. Fantastic. Okie dokies. Okay. Self-care advice for travel sickness. Okay, so if you're kind of like in a car or if you're on a train, okay, or on a boat, okay, sometimes, you know, kind of like I remember if I tried to revise, if I was in the back of the car, I would get travel sick. Okay, but if I done it on the train, I'll be perfectly fine. How odd. Okay, so generally sometimes with patients, like, you know, if you're reading, for instance, if you're in a car or on the train, sometimes that can actually trigger or worsen kind of like the nausea with the travel sickness. Okay, getting some fresh air always helps to kind of to relieve nausea, keeping well hydrated, and often this particularly works if you are seasick. Okay, considering that when my parents first got their boats, I was very seasick to start off with, and then I got used to it. If you focus on the horizon, so if you're on a boat and you're focusing on that horizon, you're focusing on something still, the seasickness kind of like tends to kind of like disappear. And it's kind of like similar, for instance, if you was on like a train and you know, or anything like that, guys. If you focus on a still object, kind of like you kind of like your symptoms of travel sickness tend to alleviate a little bit. Okay, try to avoid having such large meals and alcohol before traveling, and sometimes, you know, you can see kind of like those bands that you can get in the pharmacy, right? So they come up those travel sickness bands. Okay, so essentially they can actually apply pressure onto your pressure point, and sometimes that can actually help patients kind of like with travel sickness as well. So you guys like revision tables? I have got you a revision table. Woo! Tables, woo! Nice. So, tablets, medicines that you can actually sell for travel sickness. We've got Cenarizine. Okay, so it's going to be like your Sturgeon. This is going to be suitable if the travel is going to be between 4 and 8 hours. Okay, it is suitable from 5 years of age and over. Okay, it is an antihistamine, and of course is an antihistamine that also binds to the muscarinic receptor, so therefore it is going to cause drowsiness, sedation, constipation, urinary retention, you know, kind of like dry mouth as their side effects. Okay, because of the anti-muscarinic side effects, the cautious and contraindications are of course are going to be glaucoma, benign prostatic hyperplasia, you know, kind of, and of course they're going to be contraindicated in myasthenia gravis. And of course, with the terms of the drug interactions, it makes you kind of like a little bit sleepy. So therefore, there's going to be increased risk of, you know, kind of like that drowsiness, that central nervous system, kind of like depression, with kind of like with alcohol, antipsychotics, benzodiazepines, Z drugs, for example, like your zopiclone, zolpidem, etc. Okay. So in terms kind of like of your promethazine, okay, so it's going to be like the one which is licensed in particular for travel sickness. Technically, you can also sell the Phenergan, okay, but there's one called Avamine. Yes, I will show you a picture of it to you guys as well, okay, on my phone, just so I can go get around the copyright law. So essentially you can do promethazine. Promethazine is more suitable kind of like for longer kind of like travel periods, so anything longer than 8 hours. So let's say, for example, you're going to be on a boat, okay, or in a ferry, for example, for a very long time, okay, kind of like the promethazine obviously kind of is going to be much more suitable. And of course that's going to be exactly pretty much the same as the Cenarizine. It's going to be suitable from 5 years plus, causes the same side effects, it's the same cautions and contraindications and interactions as the Cenarizine. Okay, you're also going to have your hyazine. This is going to be things like your quells. Okay, and you also got Joyrise. So Joyrise is suitable from the age of 3. Quells, like normal adult, like normal quells, there's going to be 10 years plus, and you can also have quells kids, which is going to be suitable from 4 years plus. It is going to be an anti-muscarinic, so therefore it causes dry mouth, sedation, constipation, urinary retention as those side effects. Cautions and contraindications, once again, it's going to be your glaucoma, benign prostatic hyperplasia, and of course it's going to be contraindicated in myasthenia gravis. Okay. In addition to drug interactions of note in terms of increased risk of central nervous system depression, okay, there is also going to be additional the anti-muscarinic side effects, okay, kind of like is actually going to be enhanced, you know, if you have your hyazine with things like your tricyclic antidepressants, so for example your amitriptyline, nortriptyline, etc. Okay guys, if that's clear, give me a 1, give me a 1, guys. Fantastic, fantastic. If anything's not clear, please do let me know, guys. I am not feeling myself because at this moment I think I need an eyeball transplant. Right, okay. Okay, Infestations. Okay, we are now talking about creepy crawlies. Okay, so we have now finished kind of like our pediatrics, our respiratory, ophthalmology, kind of like our neurology, okay, kind of like, and of course I've always thrown in some extra bits to make sure that you know as much as possible kind of like for your exam, guys. Okay, so today we're going to be going over infestation, so it's going to be threadworm, scabies, ringworm and head lice. Okay, so if you're ready, give me a yay, give me a boom. Okay, so we can actually get smashing on with this, guys. Nice, boom, boom. Nice, 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 nice. Amazing, amazing. Okay, so like I said, we're going to be covering threadworms, scabies, ringworms, and head lice. Okay, so threadworm. Okay, basically the fancy medical term for threadworm is going to be Enterobius vermicularis, and basically that means kind of like it's a parasite infection of the gastrointestinal tract. Okay, how do we get threadworm? Okay, and it's going to be caused, the transmission is going to be from transmitting these parasite eggs. Okay, this can either be done by the fecal oral route, where the eggs are going to be stuck underneath our nails. So basically, let's say for example you go for a number 2, okay, you don't wash your hands, okay, and that's just as an example kind of like how you can actually get threadworm. You can also have you can also have a retro infection. Okay, this is kind of like where kind of like it's the female kind of like threadworms, they kind of like they lay eggs in the anal mucosa. Okay, and that's basically kind of like when they do that, that's what causes the itchiness, but we'll cover that in a second. Okay, and then kind of like the worms kind of travel back up kind of like into the intestines. Okay, they can also become airborne. This sounds a little bit weird. So let's say, for example, if I had threadworm, okay, kind of like, and I start shaking kind of like my bed sheets or towels, which are going to be contaminated by the lovely little wormies and eggs. Essentially, kind of like you're going to be shaking them all around the air, and then someone else could inhale it. So let's say, for example, Cameron could inhale it, and therefore he is now contracted with threadworm. Okay, and also direct contact, okay, particularly with those contaminated surfaces, and they can last on the surfaces for up to 2 weeks. So symptoms, okay, the most classic one is going to be an itchy bottom, and that's going to be worse at nighttime, and that is basically because where the female threadworms lay their eggs. Okay, so the female threadworms are going to lay their eggs, okay, and they release the mucosa, and that's what causes the itching. You can actually visually see the threadworms. Okay, they're often going to be very small, cream and white, obviously kind of like in color, and you'll kind of either see them either in your stools, underwear, or bed sheets. Okay, if there's going to be quite a severe infection going on kind of like with the threadworm, you know, kind of like things that you may notice is that's going to be a bit of weight loss, loss of appetite, insomnia. Okay, or if people are going to be scratching their bottom because they've got an itchy bottom because of the threadworm infection, okay, they may have a potential secondary bacterial infection, okay, by breaking that skin barrier and allowing that bacteria kind of like to get in. Okay, is that clear so far, guys? Give me a 1, give me a 1. Fantastic, fantastic. Okay. So in terms kind of like of your differential diagnosis, guys, okay, so differential diagnosis can include stuff like your ringworm and sorry, not ringworm, roundworm and tapeworm. Okay, it's very unlikely, okay, for patients obviously to be having that within the community pharmacy. It's more likely going to happen if you travel to developing countries. Okay, so a roundworm looks more like an earthworm. Okay, and a tapeworm is going to be they're going to be like the cream and white color in a similar way to threadworm, okay, but they're going to be flat. In addition to this, it could also be a potential other differential diagnosis is going to be contact irritant dermatitis, because dermatitis is obviously going to cause itching, and if it's going to be affecting the perianal area, okay, kind of like you can't see me. That's because I am currently trying to put some eye drops into my eyes. So sorry, I've turned off my camera on purpose. Apologies. So Dermatitis, okay, kind of like can cause perianal itching, because essentially dermatitis causes itching kind of like in general, but if it's going to be affecting the perianal area, of course you're going to be also having an itchy bottom. If no one else in the family kind of like has threadworm symptoms, or there's no visible signs kind of like of threadworm, you may want to consider this as a potential differential diagnosis. Okay, is that clear, guys? Just give me a 1, guys. Give me a 1 if that is clear. I say give me a 1, but I can't actually see the screen with my gammy eyeball. So okay, fantastic. Okay, red flag referrals for threadworm. Okay, we are going to be looking at be proud. Okay, what a bizarre thing for me to come out with. Okay, be proud. What? Be proud that you have threadworm. You never know. Okay. So in terms kind of like of red flag referrals, okay, B is going to stand for blood kind of like in the stool, okay, and then P is going to stand for pregnancy, because we cannot kind of like supply anything obviously kind of like to patients with threadworm, those who are particularly if they're pregnant, okay, if they have recently returned from a holiday, and particularly if it's like a developing country kind of like as well, because it could be a potential kind of like roundworm or kind of like a tapeworm as well. OTC treatment failure, unexplained weight loss, and diarrhea. Okay, and just a question here, can it be for under 2? Also, I am going to cover this, but yes, you can also consider those under the age of 2, and I'll explain that in a second, guys. So far, is that clear with everybody so far? Give me a 1 if that's clear, guys. I am really cautious if I am rushing through things, so just tell me. Okay. It's a good pace. Okay, that's good. Okay, so talking about in terms of our threadworm. Okay, so the product that essentially that we can sell over the counter kind of like for threadworm is Ovex, which is going to be your mebendazole, and it comes as tablets and it also comes as suspension. Okay, so the OTC age product license is going to be 2 years plus, even though it is perfectly safe. If you look in the BNF or mebendazole, okay, for the treatment of threadworm, you can actually give mebendazole to children aged 6 months to 2 years, but it has to be on a prescription. Okay, so the dose is going to be to take 1 single dose, okay, and then take a second dose after 2 weeks if those symptoms recur. Okay, particularly for children, if they don't want to be having like swallowing tablets, the tablets can be chewed and they're going to be an orange flavor, and the suspension is going to be a banana flavor. Most common side effects of mebendazole is going to be gastrointestinal discomfort and diarrhea. Okay, and generally they say to avoid an epilepsy because it can interact, you know, with phenytoin and carbamazepine, and you also avoid in pregnancy because there has been reports of fetal malformations. Okay, so is it because they are enzymes inducers? Yeah, it is, and yes, it does also interact with cimetidine. Although, when was the last time you saw cimetidine on the prescription? Cimetidine is not commonly prescribed now because it interacts with absolutely bloody everything. So, and to be honest, like in terms of like, you know, like your carbamazepine, phenytoin, cimetidine, you know, there's always going to be kind of like drugs, okay, that interact with everything. Okay, so like cimetidine is like a very complicated H2 receptor antagonist, isn't it? Okay, it's not nice. It just interacts with everything, right? It's just a complicated kind of like drug out of the whole drug group. Okay, so in terms kind of like of treatment of threadworm, obviously kind of like for women who are pregnant and for children under the age of 6 months, we need to give hygiene measures for 6 weeks. Is that clear with everybody? Just give me a 1, give me a 1. Fantastic. Okay, so hygiene measures. Okay, we need to keep our nails short, but be having long nails. If you have lovely long nails, okay, kind of like the eggs are going to be having a great time under your nails. Okay, scrub the nails. Okay, and thoroughly wash hands. You know, kind of like very, like before your meals, okay, kind of like to try and stop that fecal oral route, okay, and after each visit to the bathroom to prevent reinfection. Wash your bed linen, towels, and sleepwear on the first day of treatment, okay. They also another advice is to wear underwear underneath night clothes to prevent scratching, and also when you wake up in the morning, okay, this is going to sound rather kind of like gross, but when you start your treatment, okay, so essentially you're going to be having the exit kind of like the worms kind of like and the eggs, right, and it's going to be coming out of your bottom. So when you wake up in the morning, first thing that you need to do is go for a shower, okay, and particularly wash that kind of like basically wash around the anus, okay, to make sure you're going to be removing away kind of like those any worms and eggs that would have actually come out overnight. Is that okay with everybody, guys? Give me a one, just so I know we can move on. Very clear, fantastic. Okay, guys, look at this, look at these pictures. Can you guys tell me what is this picture? Scabies, 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 scabies. Nice. Okay, do you ever find like when you're in the pharmacy, right, and someone says that like and the patient's asking for treatment for scabies or head lice, that you start becoming really itchy, like a psychosomatic thing? A little bit. And then like, you know, when someone says like, oh, there's head lice, like you do the instant step back, don't you? Be like, oh yes, yeah, the creepy crawlies. I did it when they cough near me. I know, people cough on us all the time. Like, what the hell? No wonder why I'm sick all the time. Okay, so going back onto this, guys, okay, kind of like we've got scabies kind of like in this picture. Okay, so it's caused by Sarcoptes scabii. I can never pronounce it right. So basically it is a lovely, lovely contagious skin infection, and it can affect absolutely anybody at all ages. It's going to be kind of like transmitted via close direct contact, so for example holding hands, hugging, sexual contact, etc. Okay, and essentially you're going to have these mites, they're going to burrow into the skin, and essentially by those kind of like mites kind of like burrowing into the skin, that is what's going to give you your silver kind of like lines, your silver grey lines, but sometimes they can also look a little bit blue as well. Essentially kind of like by having those mites causing the burrows into the skin, okay, it can cause an allergic reaction to the skin, okay, and that is because the females lay their eggs, okay, when they burrow into the skin, they release the saliva and feces, and it's going to be that saliva that causes the intense itching, and you know, kind of like sometimes the itching and the scratching can lead obviously to the development of the rash, okay. And these lovely mites can actually live up to 4 to 6 weeks at a time. Is that clear so far, guys? Give me a one, give me a one. Smashing, 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 smashing. Okay, symptoms is we're going to have a rash, we're going to have intense itching, and the itching is going to be worse at night time, and we're going to be having those blue silvery kind of like grey lines. Okay, most common places which are going to be affected is going to be fingers, toes, kind of like your genital areas, buttocks, and sometimes your wrists and ankles as well. So differential diagnosis, guys, is going to be, you may want to consider things to consider is going to be things like an insect bite, okay, and that's going to be an itchy papule after being bitten. It's very unlikely kind of like that with an insect bites that you kind of like get a rash kind of like with the insect bite. Sometimes if you scratch it, it can give you like a little bit kind of like of a rash, and of course with an insect bite you can get that secondary bacterial infection, particularly if you scratch the insect bite, and therefore it's going to be kind of like the red hot swollen. Okay, and to be honest, when you get bitten, even if you get loads of freaking bites, they often going to be tend to be quite asymmetrical. Okay, Other things could be allergic, kind of like, or contact dermatitis. And essentially this way you're going to have red itchy patches on the skin, and often patients are going to have a, kind of like a medical history, kind of like of dermatitis. Okay, particularly if they have atopic dermatitis, it's going to be affecting them from a very young age. Okay, and they will also have an idea about kind of like what potentially triggered the rash as well. You also have Pomphylux, okay? This is going to be intense itchy blisters, kind of like on the palms of the hands, okay? And occasionally on the feet. Has anybody seen this before, guys? No? Okay, let's see if I can get a picture up on Google on my... Never. It's very rare, to be honest. You're not going to see much of it, to be honest. Okay, so can everybody see that picture? The kind of like the little blisters kind of like on the palms of the hands. It can also occur on the soles of the feet as well. If you can see that, just give me a one, give me a one. Yeah, just so you got an idea kind of like what basically kind of like what this looks like. Okay, hashtag getting around copyright laws. Fantastic. Okay, and you can also have other potential differential diagnosis is going to be dermatitis herpetiformis, and once again that's going to be itchy clusters of papules. Okay, and it's often going to affect kind of like the elbows, knees, and also the buttock area. Has anybody seen this before? If you haven't, give me a nod and I will show you a picture. Sometimes, like when it comes to like these conditions, it always helps that if you look, right, it helps you to identify things a little bit better. Yes, the previous slide was symptoms. Okay. Can everybody see that? Yeah, so that kind of like gives you kind of like a bit of an indication. Okay, it looks really completely different to scabies, doesn't it? Let's be real. But not everyone actually would actually have it that bad. Okay. Red flag symptoms kind of like for scabies, essentially is going to be the 3 S's. Okay. So the 3 S's is going to be the secondary infection of the skin, severe extensive symptoms, and essentially if you are suspecting someone to have dermatitis herpetiformis, okay, which is that lovely picture I've just showed you, you are going to be referring patients with that condition. Okay. Can I see symptoms again, please? Okay, so the symptoms for scabies is literally rash, intense itching, worse at night time, blue, silver, grey lines, affects the fingers, toes, wrists, ankles, buttocks, and genital areas. Fantastic. Okay, so treatment. Okay, everyone in the household needs to be treated because it is contagious. Okay, even if they don't necessarily have those symptoms, okay, kind of like they need to be treated, okay, and because it can take actually up to 8 weeks, okay, kind of for the symptoms to occur after being infected. Okay. Sometimes when you do use your treatment, okay, you patients will still complain of itchiness and wonder if essentially the treatment has been successful, okay, and it is successful in many cases, but it's just unfortunately kind of the itchiness, the intense itching, okay, kind of like for can actually last 2 to 3 weeks after treatment. Okay, once again, you need to be washing kind of clothes, your towels, and bed linen. Do it on a high, obviously, temperature at 50 degrees centigrade, kind of like or above. Okay, and that's basically to prevent the reinfection and transmission to others. Okay, just got a question here. Does everybody need to be treated in threadworms also? I am so sorry, I must have forgotten to mention this. Yes, the family needs to be treated. Ideally, even if you haven't got symptoms, okay, ideally the whole family would need to be treated. I'm so sorry. That's because I'm not thinking straight because I'm in absolute agony. Sorry. I hope that answers your question. Yeah. Okay, so kind of like in terms kind of like the products over the counter for you know, kind of like for scabies, okay, is going to include things like permethrin, which is going to be like your light clear kind of like dermal cream, okay. It's going to be suitable from 2 months plus, okay, doesn't necessarily have any drug interactions, doesn't really have any cautious or contraindications, okay, but how you apply it all over your body, including kind of like the face, neck, ears, and face, the scalp, face, neck, and ears. Okay, you keep obviously the permethrin on for a period of 8 to 12 hours, and then you wash it off. Okay, if your hands are washed, if you wash your hands kind of like within this 8-hour period of the application, you would then need to reapply the product. Okay, you also have things such, for example, like Methalion, okay, which is going to be your Durbac M liquid. You need to apply this once again all over the body, okay, but you wash it off after 24 hours. And once again, if you wash your hands within 8 hours of actually putting on kind of like the Durbac M liquid, you'll need to reapply to those areas, okay? But your Durbac is going to be suitable from 6 months plus, okay? And sorry, can you just please ignore my typo there? Is where I copied and pasted my table, okay? The side effect obviously is not going to be blurred vision upon instilling drops. Apologies, okay? It doesn't really cause that, it doesn't really cause much side effects, to be honest. It can cause a little bit kind of like of itchiness and cause a little bit of redness. Other products can include Chromaticon, which is going to be your Urax cream, okay? It is not something that actually kind of like cures kind of like, or kind of like treats the kind of like the infestation, okay? But what it does do is very good obviously for treating the itchy areas, okay? So you apply it to your itchy areas for 3 to 5 days, 3 to 5 consecutive days. You then is suitable from 3 years plus, okay, but you know, kind of like it doesn't really have any drug interactions, cautious interactions, okay, and it doesn't really have many side effects that needs to be reported. Yeah, so okay, so basically in terms of sorry, I'm getting so many messages through. Hang on 1 second, guys. Let blind Pew actually have a look through these messages. Okay, so will antihistamines help in threadworms and scabies for itching since the symptoms are going to be worse at night time? Yeah, there's no harm in actually giving antihistamines, okay, kind of like to try and help the patient, obviously kind of like whatsoever. But of course, if we actually treat the underlying problem, okay, kind of like, you know, that's going to be kind of like the best treatment for the itchiness, but there is no harm in giving these patients antihistamines as well. Oh, yeah. Repeating the side effects of Methalion, okay? So where I'm talking about the blurred vision upon instilling drops, that's obviously a typo. So I copied and pasted kind of like the slide and edited it, okay, to put my Methalion in there. It doesn't cause much side effects. It can cause a little bit of pruritus, okay, so a little bit of itchiness, and can cause erythema as well. Okay, let me just scroll down. Okay. So sorry, I don't mean to delay, but for threadworm treatment, if one family member is say 4 months old and all family members have to be treated with lifestyle measures, or would you refer? Okay, so 4 months old, okay, kind of like you would, it would just be hygiene measures. Anyone else can be treated, okay, but remember the OTC product license is 2 years plus, okay, but from the age of 6 months to 2 years, mebendazole can be prescribed. Yep, so I've got it here that essentially all members of the household and those in close contact with the patient should be treated even if they don't have symptoms. Okay, is that clear of everybody so far? Just give me a 1, give me a 1. Fantastic, fantastic. Okay, so if that's clear of everybody, we're just going to move on to head lice. Okay, So head lice is pediculus capitis, basically is human head louse, okay? And often kind of like the louses kind of like are going to be kind of like a grey or a brown in colour, and they're going to be teeny, insy weedy things, okay? Of course, head lice is going to be very common amongst school children. There's often always going to be kind of like a head lice kind of like breakout, you know, kind of like in schools, okay? But head lice can actually affect everybody. It can affect adults as well. Okay. Okay, so transmission is literally just going to be close head-to-head contact. Okay, and essentially what happens is that kind of like the female louse lays their eggs kind of like on the hair shaft. Okay, okay, and as a result, kind of like the eggs are just going to basically stick kind of like onto the hair. Okay, over a period of 7 days, kind of like the eggs can then hatch. Okay, and that is then going to give you, obviously when the eggs hatch, that's going to give you the louse. Okay, that's going to be moving around obviously in the hair, and essentially what's going to be left is going to be the nit, which is going to be the empty egg shell. Okay, so in terms kind of like when the eggs hatch, they're going to be kind of like little baby obviously lice, very young lice, and then essentially it can take 12 days in order for that young lice obviously to grow into an adult louse. Okay, so how they feed is that they suck blood obviously kind of like from the scalp of the infected person. If that's clear, guys, so far, give me a one, give me a one. Fantastic, fantastic. Okay, symptoms. Okay, people are going to be scratching their heads. School children are going to be scratching their heads, and this is going to be because the allergic response. Okay, when the louse are going to be kind of like releasing their saliva. Okay, but sometimes, okay, kind of like the itching can be kind of like a bit of a delayed reaction. You know, kind of like you can actually have head lice and not be itchy whatsoever. Okay, generally kind of like how you actually confirm the lights kind of like a head lice, it is going to be when you kind of like inspect the scalp and you can actually see kind of like head lice in there. Often you can actually do kind of like wet combing, kind of like called dry combing, and essentially if you see the lice, obviously that's going to be a confirmed diagnosis. Okay, also you can do this by actually detecting nits, which is going to be those little kind of like creamy kind of like white eggshells, which are going to be attached to the hair shaft. And often kind of like you can feel like there's going to be something moving kind of like in the hair. Sometimes in very severe cases, you can actually have a rash at the back of the neck. Is that clear with everybody so far, guys? Just give me a one. If that's clear, guys, give me a one, give me a one. Fantastic, fantastic. Okay, so differential diagnosis. Okay, one thing is going to be dandruff. Okay, dandruff occurs because of the hyperproliferation of the skin cells on the lights of the scalp. Okay, as a result, it becomes dry, flakes off. Okay, and it's going to be visible, kind of like in kind of like the hair, and also kind of like on the shoulders. Okay, and sometimes on your clothing as well. Okay. Other differential diagnosis is going to be seborrheic dermatitis. Okay, in babies, okay, in young, you know, kind of like in very young children, it's going to be seen as cradle cap. You know, kind of like those large yellow greasy scales and crusts on the scalp. Okay, but in adults, it's going to be kind of like is going to become like a red greasy scale, which is often going to affect the likes kind of like of the face, the eyebrows, the scalp, okay, kind of like your eyelid areas, ears and nasolabial folds, and sometimes your mid chest as well. It's going to affect those areas because essentially that is where you're going to have the highest amount of sebecous glands, and that is where seborrheic dermatitis is affected. It's going to be those parts of the body where you have higher amounts of sebecous glands. Okay, so treatment, guys. The first thing that we need to be doing is wet combing. Okay, regular wet combing, you can do this using a fine tooth comb. Okay, essentially if you do it over a piece of paper, okay, or a colored piece of paper, you can actually see kind of like it makes it easier to see kind of like the head lice or kind of like the nits, for example. Okay, it just makes it kind of like a lot easier basically to help you with detection kind of like of the head lice. Okay, When obviously doing your wet combing, it needs to be combed at one section at a time, okay? And every time you need to be wiping kind of like that comb clean, kind of like for tissue or cloth after each stroke, okay? Otherwise, essentially, if you get obviously kind of like the nits out and you don't obviously clean the comb, you're just going to be reintroducing them into the hair when your net's going to be kind of like putting that comb through the hair, okay? In particular, when it comes to wet combing, okay, is where you have like a particularly behind the ears, okay, kind of nape of the neck, okay. Generally, the whole head for wet combing, okay, takes about 30 minutes. Obviously, kind of like do it, and you repeat it after 3 days for at least 2 weeks, okay. So with wet combing, you basically just wash the hair, put some conditioner in, and then you obviously kind of like start obviously getting your fine tooth comb, and then you'll be going through the hair. If that's clear with everybody, just give me a 1, give me a 1. Fantastic. Okie dokies. Okay. So treatment kind of like of head lice. Okay, so we're gonna have the lights kind of like of permethrin. Okay, so it's gonna be your light clear cream rinse. Okay, and it's gonna be suitable from 2 years plus. Okay, kind of like and you're gonna put that onto shampooed hair. Okay, you can actually leave it on for 10 minutes. Okay, and then you can actually kind of like wash it out. Okay. We've also got Methalion, which is going to be a Durbac M liquid. You apply it onto dry hair. Okay, you leave it on for a period of 8 to 12 hours, and you can repeat the application after 7 days. Okay, and you also have your full marks. Okay, so full marks is going to be your isopropyl moisturate. Okay, you apply that to dry hair, but leave it on for 10 minutes. Okay, so in terms of kind of like your light clear is suitable from 2 years plus. Full marks is 2 years plus. Your Durbac M liquid is 6 months plus. You're also going to have dimethicone, okay? So in terms of your dimethicone products, you have Hedrin lotion and spray, both of which are going to be your 4% dimethicone. You can apply both of those onto dry hair, leave it on for 8 hours and repeat after 7 days, and it's going to be suitable from 6 months plus. You also have NYDA, which is going to be your 92% dimethicone. You can apply it onto your dry hair, leave it on for a period of 8 to 12 hours, and you can actually repeat that application after 7 days. Okay. It's going to be suitable from 2 years plus. You've also got your Hedrin, 4%, obviously kind of like you've got your 4% Hedrin, and it's going to be kind of like, it's called your Hedrin Once Gel. You can apply it onto dry hair, but you only leave it on for about 15 minutes, and it's suitable from 6 months plus. Okay, so after you've actually used this treatment, okay, you can actually do kind of like detection combing 2 to 3 days after using the treatment, and if there's no lice found, okay, you repeat obviously kind of like that combing again, okay, 8 to 10 days after the treatment, and then essentially if you still haven't found any lice, okay, then the treatment was successful. Okay, the most important thing is that you only treat with these products when essentially when there's been the actual detection of head lice. Okay, you do not use it for preventative therapy. Okay, because a lot of people would actually want to purchase obviously kind of like these products, okay, because they think the child actually has kind of like head lice, okay, but essentially is only suitable and is only going to be useful if there's going to be an active diagnosis, okay, kind of like for head lice, if that makes any sense. If that's clear for everybody so far, give me a 1, give me a 1. Which one would you recommend? In terms kind of like of all of their efficacy, they're all kind of like just as equally kind of like as effective as one another, to be perfectly honest with you. I haven't found that kind of like if one's going to be slightly better than the other. So in terms kind of like of their clinical efficacy, there isn't anything that's actually going to be kind of like first line, second line, or anything like that. Sometimes can be dependent on kind of like what's going to be easier kind of like for the parent, for example. So, you know, kind of like sometimes it's easier just to leave it on kind of like for 10 minutes and then wash out the hair, for example, or some of the products. Okay, any other questions, guys? Any other questions? Sorry, I'm seeing things about kind of like worsening and alcohol content. Yes, so there's a variety kind of like of alcohol content, kind of like with these products, guys. Some is the products with have a higher kind of like alcohol content, okay, kind of like which are which can actually kind of like can actually potentially worsen the asthma symptoms. Any other questions, guys? Any other questions? Okay, so is that why NYDA is suitable for asthma? I believe so, but I will double check for you. I will double check for you. Give me 1 second just to triple check. Because I am now self-doubting myself. Can I go back a slide, please? Okay. So yeah, I've just triple checked about kind of like they're based in terms of dimethicone products. They're perfectly fine in asthma. I did just double check myself because I've got a little bit of self-doubting in myself. But no, dimethicone is perfectly fine in patients who have asthma. Okay, so I've just gone back a slide, guys. Okay, if I'm okay to move on, just give me a 2. Give me a 2, guys. Okay, so in terms of which ones I've got, obviously, which can use an asthma, it's on the table, guys. I have put it on the table. Okay, right. Guys, can you identify this condition? Can you identify? Can you identify? Yeah, fantastic. Getting lots of answers through, guys. Lots of answers, lots of answers. Yeah, ringworm, that is the correct answers, guys. That's the correct answer. Fantastic. Okay, so talk about ringworm. Okay, so ringworm is going to be a fungal infection, and essentially kind of like the medical term is going to be called tinea corporis. Okay, and that's going to be the basically kind of like the fungal infection of the body, and essentially has a nickname of ringworm. Okay, because as you can see, kind of like in the pictures, it pretty much just looks like a ring, doesn't it? Okay, just to give you kind of like an additional kind of like bits of facts about kind of like other fungal infections about in other parts of the body. Okay, if you see tinea cruris, okay, kind of like is also nicknamed as jock itch. Okay, that's going to be a fungal infection of the groin. Tinea capitis, okay, in terms of tinea capitis, that is going to be a fungal infection of the scalp. Tinea manum, that is going to be an infection of the hands, and in trigo, that's going to be skin folds, so for example, in between your fingers, okay. How is a fungal infection going to be spread? It's going to be transmitted by direct contact with someone who already has it, okay, or potentially an animal, okay. You can get it from an animal or by sharing belongings. So symptoms, okay, of tinea corporis, okay, it's going to be kind of like the major skin surfaces, you know, kind of like, but does not include your scalp, face, hands, or feet. It's kind of like your major kind of like body kind of like area. That's going to be kind of like your ringworm. Essentially, you're going to have pink, red, itchy, raised patches, and sometimes you can actually have a little bit of scaling. Okay, this essentially with ringworm, you're then going to have that central clearing. Okay, kind of like that central clearing can occur, and that's going to cause a red border. Okay, kind of like with that, with the center, it's actually going to look that little bit more pale. And the patches, obviously, they kind of be, they can have a crop, they can occur either singularly, kind of like, or they can occur in different parts, okay, multiple, but all in different places, and sometimes they can overlap one another. Okay, so just had a request to go on to the previous slide. There you go. And that one as well you wanted. There we go. Okay, so tinea cruris and tinea capitis. Okay, so tinea cruris, apologies about the gross image there, okay, but essentially kind of like in terms of tinea cruris, that's going to be your jock itch, and that's going to be your scaly red lesions around your genital region, and it can affect it inside of the thighs. Okay, I didn't think you would appreciate a genital picture, so therefore I got you one of the of the inner thigh. Okay, tinea capitis, remember that's your fungal infection, okay, kind of like your fungal infection, kind of like of the scalp, and you're going to have scaly patches, and often it's going to be very itchy, and patients are going to have hair loss as well. Okay, but the hair loss is going to be kind of like quite patchy. Okay, where it's going to be kind of like a very kind of a clear defined area where that infection is. Like for example here, you can just see there's absolutely no hair there because it's all fallen out because of the fungal infection. Okay, so what do you use for jock itch? You can use clotrimazole cream. Even kind of like things that you'll see on prescriptions as well. You can use Dactocort cream. You can get the small pack of Dactocort over the counter, which is not in the fridge, but the 30-gram one is often used on the prescription for the treatment of tinea cruris as well. So imidazoles are actually suitable kind of like for the treatment of tinea cruris. Tinea pedis will go through athlete's foot in a lot more detail when we go through kind of like the dermatology, but here you go, here's some soggy, smelly feet for you, okay? So it's going to be, the skin's going to look quite white, it's going to be quite soggy, the feet are going to stink, okay? Kind of a typical kind of like sweaty feet smell, it's going to smell, it's not going to be nice, okay? Athlete's foot, so basically tinea pedis, is often going to affect the webs kind of like basically in between kind of like the toes, okay? And sometimes in some more severe infections, it can spread to the nails, causing onychomycosis, and the plantar surface kind of like of the feet as well. And of course, it's going to be very, very itchy as well. So Differential diagnosis, kind of like a ringworm, okay, it could be potential psoriasis, okay, we know that psoriasis is that chronic inflammatory skin condition, and it's going to be characterized by those thick raised kind of like patches and scales, which is going to be kind of like on the extensive surfaces, so for example on your elbows and knees. It is going to be relapsing, remitting, okay, it's going to be there for a long time for many people, and it can be triggered by all sorts of things. Can be triggered by stress, sunlight, some medicines. So for example, lithium and ACE inhibitors can be act as a trigger for psoriasis, okay. And generally kind of like patients can either be diagnosed kind of like at the age kind of like of like 15-ish, okay, kind of like in the teenage years, or it can have an onset kind of like at midlife. Same with obviously allergic or contact dermatitis. This is going to be another differential diagnosis to ringworm, and it can be very easy to diagnose because both dermatitis and ringworm also give you kind of like red itchy patches, okay. But often kind of like patients will have a personal history kind of like a dermatitis, particularly if it's atopic dermatitis. They're going to have that from a very young age. It's going to affect them before the age of 2, and they're also going to be able to tell you kind of like what potentially triggered the rash. Red flag referrals is going to be kind of like for ringworm. Red flag referrals is going to be involvement of large areas of the trunk, OTC treatment failure, and suspected facial hand involvement. Okay, so remember IOS, that is going to be your red flag referral for ringworm. Is that clear for everybody so far, guys? Is that clear so far? Fantastic, amazing. Okay, and we've got more tables, okay. So we've got our imidazoles, okay, so we've got miconazole, clotrimazole, ketoconazole, okay, and you're also going to have your imidazole and steroid combinations. So examples of like your antifungal and your steroid combinations is going to be things like your Dactocort, which is going to be your miconazole hydrocortisone. And you're also going to have canesten HC, and your canesten HC is going to be your clotrimazole and hydrocortisone. Okay, for your antifungal products and your antifungal creams, okay, there is no lower age limit stated on the products, okay. In many of these, there doesn't state any lower age limit, okay, but of course, if you're going to have your combo products, okay, they contain a steroid, okay. We know that hydrocortisone cannot be sold to those under the age of 10, so therefore the combination products have a product license of 10 years plus. Okay, how often you will need to apply these creams? Okay, twice a day. Okay, clotrimazole, you can actually use it up to 3 times a day. Okay, kind of like in terms kind of like of miconazole and warfarin be a contraindication. The cream is fine. The cream is fine with the warfarin. Okay, because if you're using the miconazole cream, okay, the miconazole cream doesn't get absorbed into your blood. Okay, so it can cause obviously kind of like mild burning, kind of like an itching, okay, and there isn't obviously kind of like any major kind of like drug interactions that you need to be worried about. Okay, so in terms kind of like if you're talking about in terms of if you want to look at can I repeat what I said about miconazole cream? Okay, there was a question regarding whether you can use miconazole cream on patients who take warfarin, and the answer is yes, because the miconazole cream does not get absorbed into the general blood supply. Okay, okay, with corticosteroids, yeah, kind of like any kind of like the maximum treatment duration with steroids over the counter is going to be 7 days. Okay, so in terms of you also have like your show athlete's foot range is going to have products, for example, like the drug in it's going to be kind of Toltnafate. Okay, a lot of them kind of like with the Toltnafate or the Shoal kind of like athletes product range, athletes foot range, they don't obviously kind of like have any ages obviously kind of like stated. Okay, many kind of like other products you can actually use it twice a day, but they don't have obviously any major side effects, cautious or contraindications, or drug interactions. Okay, you also have terbinafine. Okay, so you have Shoal Advance, obviously kind of like contains terbinafine, and you also have Lamisil. Okay, most of the products which contain terbinafine is going to be 16 years plus, apart from Lamisil once, which is going to be 18 years plus. Okay, and most of these products are going to be a once a day application only. They can cause like a little bit of redness, obviously kind of to the skin, and itchiness when you apply to that particular area. Okay, is that clear with everybody so far, guys? Just give me a one if that's clear, guys. Yeah, fantastic. Okay, we're just gonna do a small quick quiz, guys. If you're ready for the quiz, give me a yes, give me a yes. Fantastic, fantastic, fantastic. Girl, you sound in pain, but you got this. I am, okay? I am in so much pain. I think I'm going to be spending my night in William Harvey Hospital tonight. Okay, so guys, in terms kind of like of your first question, here is your first question. Oh my goodness, I just done a typo. I done a typo. Y is meant to be 6. Y months. Sorry, it's meant to be 6 months. That's meant to be 6 months. That is my typo. My bad. Apologies. Apologies. Yeah, we're getting lots of answers through. A. Yeah. See, I managed to obviously kind of like to fix something. Obviously, kind of like I've just done a typo on that first slide. Sorry. So the correct answer here is A, okay, because of course we can't obviously kind of like sell you know, Fredward. The OTC license is not Y months, okay. The OTC license is 2 years, okay. So therefore anyone under the age 2, we cannot sell the OVEX treatment. Okay, if that's clear, guys, give me a while, we'll move on to the next question. Fantastic, fantastic. Here is your next question, guys. Okay, fantastic. We're getting lots of answers, obviously, kind of like through, guys. Okay, so this patient has got ringworm, okay, and Did I not put the location on the question? Oh, sugar, I didn't, did I? I didn't tell you it was just on his, didn't tell you that it's just on his arm. Okay, sorry, okay. So this patient doesn't have kind of like any face or hand involvement, okay? So essentially it's just going to be, not one, make it nice, simple, ringworm, obviously kind of like case, okay? So therefore, normal, simple ringworm, we obviously want to treat that kind of like with a clotrimazole cream, okay? If there was either kind of like face, kind of like if there's actually going to be kind of like a face involvement or hand involvement, okay, of course we're also going to need to be referring that off kind of like to the GP. Okay, is that clear, guys? Is that clear? Give me a 1 if that's clear, guys. Fantastic, fantastic. Okay, if that's clear of everyone else, guys, just give me a 1, guys. Just give me a 1. Beautiful, beautiful, beautiful. Okay, it's a 2%. Yeah, so kind of at the 2% cream is going to be your Canesten thrush cream. So it's the external cream used for the treatment of vaginal thrush. Okay, fantastic. Here is your last question, guys. Oh, there's a random sorry in the chat. I'm not too sure why there's a random sorry. Oh, I see now. Okay. I was thinking, oh, I saw was like loads of C's and then a random sorry. I was like, hey, like what's going on? Right, okay, so lots of C's, guys, that's correct. Okay, the clue here is that there's some grey lines and the itching is really bad at night time, and therefore the most likely cause of the rash is going to be scabies. Okay, fantastic, fantastic, guys, fantastic. Okay, I hope you found today's session useful. Did you find it useful? Just give me a yes if you found it useful, guys. Okay, see you next week. Now please go to a hospital. Okay, yes, okay. Okay. Yes, I am going to go get some more injections probably in my eyeball. Okay, right. I'm absolutely in agony. So see you guys. Okay. Oh, thank you guys. Okay. I'm gonna be probably looking like a pirate again next week. I have a parrot on my shoulder, okay, with a nice patch on my eye. Okay. Oh, oh, I know. I know A&E is a killer. I absolutely hate it. I try to avoid it as much as I can with my eye. Absolutely bloody hate it. Okay, right. See you later, guys.